everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Miss Mary, popularly known as the Nurse with the Difference, and I make learning easy and accessible for students. Today we are going to be talking about bone fracture. What is bone fracture? What are the various types of fracture? What are the nursing intervention of fracture? What are the signs and symptoms, the causes of fracture? And we are also going to be telling you the various treatments used in fracture, such as your internal and external fixation, the application of traction, and also the application of cast. So I will advise you all to stay to the end of this video, because these are possible questions that are likely going to pop up in your exams. But before we go into details, you know what to do. Kindly click on the subscribe button, turn on the notification button so you don't miss out. Let's go there. Alright, welcome back. Like I earlier said, today I'm going to be telling you all about fracture. What is fracture? What do we mean when we say fracture? Fracture is a break or a crack or a discontinuity of a bone. Fracture is what? A discontinuity of a bone. It's creating a demarcation. For example, this is a bone. So a fracture is a break. There's a discontinuity of this bone. There's a crack in this bone, or there's a what? Discontinuity of the bone. Fracture is actually different from dislocation. Dislocation is a discontinuity in the joint, a breakage in the joint. But fracture is what? A break or a crack or a discontinuity in a bone. Then that takes us to the causes of fracture. The first we have here is trauma. Trauma could be as a result of a fall or an accident. Then the other we have here is twisting. You know when something twists. For example, injury, abuse on the child can also result in fracture. Then the other cause we have here is disease. Disease such as cancer and osteoporosis. The cancer of the bone is known as what? Osteosarcoma. So these are the likely causes of fracture. One thing you should note when it comes to fracture is that children bone tends to heal faster. Children bone, they tend to heal faster compared to an adult bone. But why? This is because the periosteum of a child's bone is stronger, thicker, and more flexible, so it can easily go back to normal. It can easily heal compared to a child's bone. The healing duration of a bone is usually 3 to 14 weeks, depending on the severity, depending on the state of the bone. But for children, it's around 2 weeks. Remember, we say that children bones heal faster than an adult bone. Then that takes us to the type of fracture. There are various types of fracture. The first question you should ask yourself is there a breakage in the skin or not? So that gives rise to this type of fracture, which is either the open or the closed fracture. We say a fracture is open when it leads to the breakage in skin. It comes out of your skin is being injured, then you see the bone. So that is an open fracture. This open fracture is also known as compound fracture. Then this, which is a closed fracture, it doesn't lead to the breakage in the skin. The skin is not involved. It is known as what? Closed fracture or simple fracture. Then the other one you ask yourself is the fracture complete or incomplete? Is the bone broken totally or it's broken halfway? That's what gives rise to the complete and incomplete fracture. In complete fracture, the bone separates totally from each other. That's two parts. But in incomplete fracture, there's no total separation on the fracture. The picture on the showing currently will tell you the difference between your complete fracture and your incomplete fracture. Then the order will now be based on the details, based on the shape, based on how this fracture occur. So we have the green stick fracture showing on the screen. This green stick fracture occurs in children majorly. It's like a bend. You know this green stick that usually bends but later gradually bounces back. Then we have comminuted fracture. In comminuted fracture, the bones are broken into fragments. The bones are what? They are broken into fragments. They are broken into pieces. They don't just demarcate into two like that. Then in order, we have the transverse fracture. In transverse fracture, there's a straight line cut. In oblique fracture, there is an oblique cut. The pictures are showing on your screen that the spiral fracture is like a twisting. There's a twisting of the bone that results in what? Spiral fracture. Then that takes us to the signs and symptoms of fracture. The first we have is bruising. Then the other is reduced mobility. You will agree with me, when the hands is being fractured or when the legs are fractured, there's going to be what? A reduced mobility. Then we have cracking sound. We have edema and neurovascular impairments. Then that takes us to the nursing intervention for fracture. Of the nursing intervention for fracture, the first thing you have to do is to what? Immobilize the fracture. Immobilize what? You have to immobilize the fracture. When you immobilize that fracture, it enables the bone to heal properly. So if you don't immobilize that fracture immediately, bone healing might be impaired. Then the second is stop bleeding. If it is an open fracture, you have to apply pressure to stop what? To stop bleeding. And also you cover with sterile dressing to prevent infection. Because if this wound is open, it's going to cause more infection to the bone. So you have to cover it with what? With sterile dressing. Then the other is elevate extremity. You elevate the extremity above the heart to help reduce edema. You also apply ice, which is your cold compress, to help what? Reduce edema. Another intervention is to keep patients on new oral till your doctor tells you what's next to do. Then also x-ray. The patient might be taken for x-ray to know the extent of the fracture and also to know the extent of the damage being caused by this particular fracture. Make sure as a nurse to document and monitor closely. This patient should be observed closely after putting the cast, after putting the fixator, after putting the traction. This patient should be observed what? Closely. You have to observe for the signs of the various complications that are likely going to arise from fracture. So examples of such complications that might arise from fracture is first, the compartment syndrome. What is being affected in the compartment syndrome is the fascia of the bone. You can drop the meaning of the fascia if you know it on the comment section. So in compartment syndrome, the signs and symptoms of compartment syndrome, it's usually remembered by the 6 P's. 6 what? 6 P's. So you have to observe for these 6 P's, which is first, the pain. This patient will be complaining of severe pain despite the pain relief being given. You have to observe for pallor. You have to compare the hand that is being affected and the hand that is not being affected. You compare. You see painness. You see the difference between the affected limb or the affected part. Then you have to check for paralysis. Is the patient moving the hand or not? Is it moving the leg? So you have to observe for paralysis if the fingers are moving, if the toes are moving. Then paresthesia, which is a tingling sensation, you have to observe for it. Poikilotema, That's the temperature. You have to observe for the temperature of the affected hand, and also the hand that is not affected. That's going to tell you that, oh, there's a problem. If one hand temperature is high and the other is low, that's to send a signal that compartment syndrome is knocking on the way. Then pulselessness. This usually occurs at the end. So these are the 6 P's of compartment syndrome you have to observe, because compartment syndrome is a complication of what? Of fracture. Then another complication of fracture is infection, and we all know the signs of infection, which is usually the hyperthermia. You can be having foul smell, like smell coming out from the affected area, maybe as a result of the cast that is being applied or something. But you have to observe for signs and symptoms. You can have drainage coming out, pus coming out from where the pins are being inserted or where the cast is being placed. So you have to observe for signs of fat embolism. You also have to observe for nerve and vessel damage. These 4 are the likely complications that are going to arise from what? From fracture. Also, in the nursing intervention for fracture, you have to monitor, that you have to talk about pain management, because most times this patient is in severe pain. So you have to talk about giving the prescribed analgesics. You have to talk about providing diversional therapy for your patient to help divert the attention from the pain. You have to talk about applying ice, which is your cold compress. So these are the nursing intervention that will help you out to manage a patient with fracture. Then that takes us to the various treatments for fracture. Okay, in terms of the various treatments used in the management of bone fracture, what I want you to note is that whatsoever the treatment is, it is actually to put the bone back in its original state. The treatment is actually to put the bone back in its original state and aid healing on its own. So in terms of bone reduction, we have closed and open. We have what? We have closed and open. In closed, it is done manually. That involves the application of casts. That's your POP and all that. The application of cast. And when cast is being applied, you have to observe for the signs of complications, which is your compartment syndrome. Like I earlier told you, the 6 P's. You have to elevate the leg. You have to apply cool breeze. You don't apply hot breeze to make the cast cool down. Rather, you apply cool breeze to enable the cast cool down and dry up. You apply cool breeze to keep it dry. So just know that in terms of the close, it is done manually. It doesn't require surgery. It doesn't require you opening the bones. It actually requires what? Application of cast. Then the other one is open. As the name implies, open. We have to open it to get into the bone to do what we have to do. And that is done surgically. It involves the fixing of devices in the bones to help healing. So the first one we have is internal fixation. Internal fixation simply means you putting the pins inside the skin. You put the pins inside the skin. For example, pins and plates. Then the other we have is external fixation. The devices are outside the skin. It is obvious. You are seeing it. So examples include your matter braces, your screw. It can also be adjusted. So take note of the fact that in terms of reduction, we have the closed reduction and we have the open reduction. The open reduction is done surgically, and it could be internal or external. Internal inside the skin, external outside the skin. It is obvious. Internal fixation involves the pins and the plates, while external fixation involves metal braces and screw. Then another method which is used for bone treatment is actually traction. Traction simply means the application of a pulling force. You are applying a pulling force to help the bone align properly and to help the bone heal properly. Thank you very much for watching our YouTube video. Thank you very much for subscribing. Thank you very much, because I know you are going to like, I know you are going to drop your comments, and I know you are going to watch and share with a friend. Thanks, and have a wonderful day ahead. See you in our next video.